Hi, I'm Chris Magnuson from Ledgelight Health District, and I would like to share with you what we've been doing at Ledgelight Health District in regards to contact tracing of COVID-19. We wanted to take a few minutes and fill you in on what we've been doing, but also to ask for your help as we go forward. We are the health district that covers Lyme, Old Lyme, East Lyme, Waterford, New London, Groton, Ledyard, Stonington, and North Stonington. Along with Mary Day, another nurse here, we have been doing contact tracing from the start of COVID-19. This is a public health tool that's used for many infectious diseases to find who the person who's infected might have been in contact with to help stop the transmission of that infection. It is something that we do with tuberculosis, measles, and other vaccine preventable diseases. We know that contact tracing is an important tool in preventing the spread of an infection. It's been used successfully during the SARS outbreak and with Ebola. So, what is it all about? Let's start with a little bit about COVID-19. I know that you all know quite a bit because that's all that our life has been consumed with on the news, and being stuck at home, I'm sure like everybody else that you've become quite the authority on COVID-19. It's a worldwide respiratory virus that's known as SARS-CoV-2, and it's easily spread from person to person. We think of it as a respiratory, we breathe it in, but also too, we know that it can land on surfaces, and depending how long it's been on the surface, how infectious that person was when they maybe coughed on a surface, will determine whether it's possible to spread if you should touch your face, your eyes, your mouth, your nose. The symptoms vary. We've been doing a lot of interviews of people with COVID-19. And some people have had no symptoms at all, and it was discovered because they were tested because somebody else in the family had COVID, or they happened to take their temperature when they went into work and discovered that they had a fever but didn't feel like they had a fever. And then sadly, there are those cases that are life-threatening. And unfortunately, there have been a lot of deaths, especially with our older generation. We know that it's contagious 48 hours before symptoms start. So when we call people, it's very important to know when their symptoms started. Interestingly enough, a lot of people have actually marked it in their calendar. And so we're able to go back 48 hours because that's a very important mark for us to know when we talk to contacts, when we determine who is a contact. The incubation period, or the time from exposure to getting the virus, can be anywhere from 2 to 14 days. We get a lot of calls from people wondering if they should be tested because they've been exposed to COVID-19. And really, unless you have symptoms, we don't recommend it because that's just a point in time. You could be negative today and be positive 2 days later and have that false sense of security. At this point, there's no real treatment. We've certainly read and seen that there's a lot of different drugs that are being used, some successfully, some not so successfully. And we have a lot of pharmaceutical companies worldwide that are working on vaccines. Once a vaccine is developed, Ledgelight Health District, along with other local health departments and districts in Connecticut and the US, will be charged with ensuring that the public gets vaccinated. So why the concern about COVID-19? Why are we doing contact tracing? Well, diseases are assigned a number called an R0, and it basically is how many people can one person who's sick with that infection affect. So Really, the most infectious disease out there with the highest R naught is measles. The R naught for COVID is thought to be anywhere between 2 and 3. And so if you look at this chart, you'll see that that one person can infect 2 people, who in turn infect 2 people. And as you can see, that it grows. So we want to stop that transmission. We want to find that person who might have been in contact with that sick person so that they will stay away from other people and not continue the transmission. So what is the process of contact tracing? What's involved? COVID-19 is a reportable disease that hospitals, laboratories, and medical providers have to provide to local health departments, districts, and the Department of Public Health. We call the person using a questionnaire. We'll ask questions about symptoms, when they started, what's their occupation, have they traveled, what's their medical history, who lives in their home, have they had any close contacts with people outside of the home, have they been at work, do they drive to work with somebody. We try to identify who the close contacts are so they can be informed and screened. When we talk to the contact, if they're well, we want them quarantined for 14 days and to monitor for symptoms and monitor their temperature. If they should develop symptoms or having symptoms at the time we talk to them, then we ask them to call their medical provider so they can get tested. And this is how the process repeats with every new case. So what do we tell people if you have COVID-19? Do not leave your home or have anyone into your home. Stay away from others in your home. Sometimes this can be difficult, especially if you're a caregiver. Maybe you're a single parent and you have children to take care of. Then we would ask you to wear a mask and do your best to not spend a lot of time with them. If possible, open windows. If you have one of the window fans, put it in backwards and maybe you can pull some of the air out. As the weather gets nicer, if you have a yard, maybe you could spend time out in the yard so that they're in the fresh air. If you share a bathroom, then it really should be cleaned after use, because we do know that sometimes COVID can be found in feces. Disinfect areas that are often touched. We call those high touch areas. The areas that are touched most often, those would be computer keyboards, your phone, maybe the remote control for the TV, doorknobs. Again, wear a mask if you're near anyone. And if you start to have symptoms and you're having difficulty breathing and you have to call 911 or maybe for another reason, please alert them to the fact that somebody in the house does have COVID-19 so they can come in wearing the appropriate protective equipment. So you want to stay in isolation for at least 10 days since the symptoms started. You cannot have fever for 72 hours. You can't use Tylenol, aspirin, or any fever-reducing medicine, and your symptoms should be getting better. You always want to follow the advice of your medical provider. If you do have any questions, especially as the week or two going by and you're still not feeling well, please talk to your medical provider. So what if you're a contact? Then we want that person to be quarantined for 14 days, and again, away from everybody else, because we're hoping that you're not going to develop any symptoms. So again, no visitors into the home. However, maybe you live alone and you have nobody to bring you food or to get you medications. If you must leave the home, wear a mask and try to go quickly in and out of a store. And as I said before, essential workers may not be able to quarantine. They're needed at work, unfortunately. If you are in quarantine, you want to monitor your temperature and symptoms daily. If you're starting to develop a fever, a cough, real bad fatigue, headache, lost sense of smell, taste, then it's really important that you call your medical provider. If you don't have a medical provider, then call the COVID-19 hotline so that you can get directed where to go for a test. Help us stop COVID-19. The state of Connecticut is going to be starting contact tracing, and Ledgelight will continue to do it with our staff and some volunteers also. It would be a tremendous help if people could still follow what's recommended as far as social distancing, wearing masks when you are within 6 feet of people, wash those hands, keep your hands away from your face. Keep track of where you go and who you see. In the off chance that you should develop coronavirus, it would be helpful to know who you've been around so that we can contact those people, especially as at that point as life begins to go back to normal in Connecticut, that the circle of people that you're going to be in contact with will grow. And so we want to be able to stop the spread by letting those people know that they may have been exposed. We won't tell them who exposed them, but to tell them that they need to be quarantined for 14 days. We hope that when we call, that you'll be willing to answer our questions. This is a new disease. We're trying to learn a lot about it, and we're not trying to be nosy. We're asking questions that are important to understand about the disease, why some people get it and others don't, to understand about transmission, to understand about symptomology. Also, keep in mind that people are going to be calling sometimes from home because we don't want everybody in at work at this point. And we do have some volunteers assisting. So if you're not sure that you can trust that they're calling on behalf of Ledgelight Health District, then please feel free to call our office at 860-448-4882 to ask. Also, when you are called and you are told what to do as far as perhaps isolation or quarantine, please follow those directions. By doing so, you are preventing others from getting sick. Connecticut signed up for How We Feel app. They've partnered with the developers in an effort to anonymously provide scientists with critical health information to understand the risk. It can be downloaded free from the Apple App Store or the Google Play Store. These are the COVID-19 hotlines. If you do not have a medical provider and you're having symptoms, then you want to call one of these hotlines and they will assist. If you have a medical provider and you think you have symptoms of COVID-19, you have to go through your medical provider in order to be referred for testing. And 211 is another source of not only information on COVID, but on so many other subjects that might be of need at this time. We hope that everyone stays well, and hopefully we won't be calling any of you in the near future.